My name's Kelly O'Neill. I'm a general surgeon at Sydney Health. I've been here for 2.5 years, but I've been a general surgeon since 1987, and I have a special interest in everything that has to do with breasts. Women and men's breasts, but with breasts. Women should take an interest in their breast health because problems related to the wellness of their breasts are very, very common, and breast cancer is between 1 in 7 and 1 in 8 women in the United States at this point. So it's both prevalent and really important on a lot of levels. I think women should start doing self-exams when they have their period, and that seems pretty young, but it needs to get to be a habit. I had a friend who was a nurse anesthetist with breast cancer, and she said it should be like flossing your teeth. You just once a month when you get your period, you check your breasts. I would say it's become discussed recently that there's no role for clinical breast exam or self-exam, and I think that's complete nonsense. It's cheap, it's available, and I can't even count how many people have come in who felt something in their breast, and that's why they came in to see me. It isn't always a cancer, but a good portion of the time it's a cancer. So a common question is, at what age should women start getting mammograms and how frequently should they get them? So for women at average risk, the age to start mammograms, assuming there are no physical findings, is age 40. I believe they should get a mammogram every year. It's been floated as an idea that women only need them every 2 years, but a lot of people, reputable organizations in the country too, disagree and say yearly, and I say yearly. And the mammogram should continue until the age at which you're not going to do anything about findings on a mammogram. So that varies. There are people with other comorbid conditions who are not going to have anything done, and there are 90-year-olds who are so healthy that you will take an action. So that's my answer for how long. And in terms of women at increased risk, this includes people where a first-degree relative had cancer, particularly breast cancer at a young age, and people who test out as BRCA1 or 2 positive, which actually occurs with some frequency in eastern Montana. Those women should be getting a structured surveillance program that includes physical exam, yearly mammograms, yearly MRI. I'd like to put in a plug for Sydney Health because I think I get my mammograms here, and it's well done, it's thorough, it's careful, it's gentle, and our radiologist is fantastic. So this is a great place to get your mammograms. Now, thank you for taking a moment to listen to me. What I'd like you to take with you is breast self-exam is important, clinical breast exam is important, frequent mammograms is important, and if you find something in your breast, don't be afraid to come in. Whatever is going on is what's going on, and we can figure out what it is and get you the proper care and treatment.